Often described as the hardest working muscle in the body, your heart is essential to your health. It pumps blood that delivers oxygen and nutrients to your entire body. In fact, your heart beats around 100,000 times and pumps about 2,000 gallons of blood every single day. And just like other muscles, your heart needs exercise for optimal health. Regular physical activity can boost your heart health and reduce your risk of heart disease. Learn more about how to move for heart health, including 6 exercises you can try. Why is it important to have a healthy heart? Heart disease is the leading cause of death for adults in the US. And given how critical your heart is in maintaining your health, it's important to keep it strong. It may not always be easy to do this, as there are several risk factors for heart disease and related problems. Some of those factors, like age and genetics, are beyond your control. Luckily, there are several factors that you can control to improve your heart health. Eating healthy, avoiding cigarettes, and you guessed it, adding exercise to your routine can help. How does exercise affect heart health? Regular exercise strengthens your heart. It can lower your risk of heart disease, cardiac events like heart attacks, and cardiovascular-related death. In fact, research shows that moderate physical activity may even reverse cardiovascular damage from an inactive lifestyle. A fitness routine can help your heart in other ways too. Exercise can lower your blood pressure, increase your levels of good cholesterol, help you maintain a healthy weight, improve blood flow and circulation. What kind of exercise is best for the heart? It's tempting to pick one type of exercise you enjoy and stick to it. But you should incorporate different kinds of physical activity for overall health and fitness. These 3 types of exercise are essential for a healthy heart. Aerobic exercise, or cardio, includes activities like swimming or dancing that increase your breathing and heart rate. Strength training, strength or resistance training uses your body weight or tools like dumbbells to build muscle strength and endurance. Flexibility exercises like stretching help joint mobility, which is critical for aerobics and strength training. Exercises to improve heart health. Any exercise you do, especially if it includes aerobics, strength training, or stretching, can make your heart healthier. So if you don't see your favorite workout on the list, that doesn't mean you shouldn't do it. What is important is that you pick a variety of exercises that you will actually do to get your heart pumping. With that in mind, here are 6 science-backed exercises to boost your heart health. Brisk walking. Walking is at the top of many heart-healthy activity lists because it is a great way to be more active. One study found that brisk walking just 30 minutes a day, 5 days a week, reduces your risk of coronary heart disease by 19%. Taking roughly 100 steps per minute or walking 2.7 miles per hour is consistent with brisk walking. If you're new to fitness, you can start slowly. Then, work your way up to brisk walking at moderate to vigorous intensity. You can increase the intensity by walking faster, using a weighted vest, or walking up and down hills or inclines on a treadmill. Running. Running can lower your risk of heart disease and may help you live longer. Because you work at a higher intensity, running burns more calories in a shorter amount of time than walking. That also means it works your heart at a higher level. Cycling. Whether you're doing it outside or inside on a stationary bike, cycling is a great way to improve your cardiovascular health. In fact, research suggests that regular cycling can reduce the incidence of cardiovascular diseases and death. Strength training. Strength training exercises like lifting weights or doing push-ups get your heart pumping. They also increase your lean muscle mass, which means you burn more calories at rest. That, in turn, can help you maintain a healthy weight. And it should come as no surprise that all of this is good for your heart. One study showed that muscle strengthening workouts reduce the risk of a heart attack or stroke by up to 70%. Yoga. You don't always have to do high-intensity exercise to get heart health benefits. Experts report that yoga promotes strength and flexibility and improves cholesterol and blood glucose levels. The mind and body practice has also been linked to lower blood pressure. High-intensity interval training, HIIT. HIIT alternates between short bursts of high-intensity exercise and longer periods of lower-intensity activity. For example, you might switch between running for 1 minute and walking for 3 minutes. Interval training strengthens your heart and helps it function properly. Some research suggests that it may even increase your fitness level more than continuous moderate intensity training. There may be a limit to the benefits of HIIT, so consider adding it to your routine once or twice a week. How much exercise do I need to improve my heart health? According to the American Heart Association, AHA, adults should get at least 150 minutes of moderate intensity exercise every week. That comes out to 30 minutes of activity, 5 days a week. You can also do 75 minutes of vigorous intensity activity every week. Or you can try a combination of moderate and vigorous intensity exercise. And if you double the recommendation for moderate intensity exercise to 300 minutes per week, the benefits for your heart are even greater. The AHA also recommends adding moderate to high intensity strength training with weights or resistance 2 days a week. If you're not sure how to measure your exercise intensity, there are some helpful indicators. Moderate intensity. Your heart beats faster than when at rest. You breathe harder, but you're still able to talk. You may start to sweat after a while. Vigorous intensity. Your heart beats much faster than when at rest. You breathe harder. You can talk, but you will have to pause to take a breath. You may start to sweat shortly after starting the activity. You can also use your target heart rate for a more precise way to know your exercise intensity. The AHA has a target heart rates chart for guidance. You can also talk to a certified trainer or health professional to help you set a target heart rate during physical activity. Is cardiovascular exercise okay for someone living with heart disease? Cardiovascular exercise is recommended for people who have heart disease, but you should talk to your healthcare provider before starting any exercise program. This is especially important after a heart attack or heart surgery, or if you've been experiencing chest pain. Your provider may recommend cardiac rehab to help you ease into approved physical activities. Progressing as your cardiovascular health improves. Even if you don't have cardiovascular disease, you should talk to your provider before starting an exercise routine, and be sure to watch for warning signs that you're overdoing it during exercise. If you have any of these symptoms, stop exercising and call your healthcare provider right away. Squeezing, burning, pressure, or heaviness near your breastbone that radiates to your left arm. Dizziness or confusion. Extreme shortness of breath. Fast or uneven heartbeat. Alright. That's it for this video.
Hey guys, make sure to like, comment and subscribe. Thank you.